Ever feel like you're carrying the weight of the world on your shoulders?
Or how about?
In your jaw?
Yeah.
Yeah, random question.
A little bit.
But stick with me, because today's deep dive is all about a surprising link between autism and TMJ disorders.
Interesting.
And trust me,
Yeah.
you're going to want to know about this.
What's fascinating here is that we often think of jaw pain as just, kind of like a common annoyance.
Right.
Maybe a result of stress or grinding our teeth at night. But for individuals with autism, this connection goes much deeper.
Okay, so let's unpack this.
Sure.
First things first, for those who
Yeah.
might not be familiar,
Right.
what exactly are we talking about when we say TMJ?
TMJ stands for temporomandibular joint disorder.
Okay.
Think of it as the hinge that connects your jaw to your skull.
Right.
The one that lets you talk, chew, yawn, all that good stuff.
Got it.
Now, when this hinge isn't working as smoothly as it should, that's when you get TMJ. And research shows that people with autism might be significantly more likely to experience these issues.
That's really making me think. I often get tension headaches, and I never considered they might stem from my jaw.
Wow.
This connection is much more widespread than many of us realize.
Yeah, I think you're right.
So why would autism make someone more susceptible to something like TMJ?
Interesting.
What's the link there?
Well, there are a couple of key factors.
Okay.
One major one is the prevalence of certain oral habits that we see in some people with autism.
Okay.
We're talking about things like teeth grinding, which doctors call bruxism,
Right.
lip biting,
Sure.
even finger sucking.
Right. And those habits, while seemingly small, can put a lot of stress on the jaw joint over time.
Yeah.
I know even I clench my jaw when I'm stressed.
Right.
And I can only imagine how much worse it would be if those habits were more frequent or intense.
Exactly. And to really highlight the prevalence of this, one study found that about 30% of children with autism grind their teeth. You know how some kids suck their thumbs for comfort?
Right.
Well, for some autistic individuals, that comforting behavior might manifest as teeth grinding.
Oh, wow.
And that, unfortunately, can have long-term consequences for their jaw health.
That's a significant number of children potentially facing these challenges.
Yeah.
It highlights how important it is to be aware of this connection.
Yeah.
But you mentioned there were a couple of key factors at play here.
Right.
What's the other big one?
The other one we need to talk about is mouth breathing.
Mouth breathing.
Yeah.
Okay. I have to admit, I wouldn't have immediately thought of that as a risk factor for jaw problems.
It might not seem obvious.
Right.
But when you breathe through your mouth consistently,
Okay.
it can change the alignment of your jaw over time, which you guessed it can lead to TMJ.
Wow. Okay.
Imagine a sapling growing towards the sunlight. If it's constantly leaning one way,
Yeah.
it'll grow crooked.
Right.
Similarly, consistently breathing through the mouth can actually cause the lower jaw to develop in a slightly altered position.
That's a really helpful analogy.
Yeah.
So we're talking about repetitive behaviors that over time can really impact the development and function of the jaw.
Right.
But here's where I think this gets even more crucial.
Yeah.
If someone with autism is experiencing TMJ,
Yeah.
it might not always be easy for them to communicate that, right?
That's a crucial point.
Right.
We know that autistic individuals might experience and communicate pain differently.
Yeah.
Some might have difficulty expressing pain or discomfort verbally. So it's really important for caregivers, family members, anyone interacting with them regularly to be extra observant.
Right.
Look for those behavioral changes, any signs of pain or discomfort.
So what kinds of things should people be looking out for specifically?
Well,
If you had to explain those signs to someone who's never even heard of TMJ,
right.
what would you tell them?
Well, the most obvious sign is any pain in the jaw joint itself.
Right.
But it's not always that straightforward.
Right.
Keep an eye out for pain in the muscles around the jaw. Or pain that seems to radiate to the face, the
Yeah.
neck,
Well,
even up to the ears.
it's funny you should mention that.
Yeah.
I get tension headaches sometimes,
Mm-hmm.
and I would have never guessed those could be connected to my jaw.
It's definitely possible.
Wow.
Also, watch out for any stiffness in the jaw.
Okay.
Limited movement.
Right.
Clicking or popping sounds when opening or closing the mouth.
Yeah.
Or even the jaw locking up entirely.
Those are some really concrete things to look out for.
Yeah.
And considering how common these oral habits are, just how widespread is TMJ within the autistic community? Are there any statistics on that?
There are, and this is where it really underscores how significant this connection is.
Okay.
Some estimates suggest that nearly 60% of autistic individuals might experience some form of temporomandibular dysfunction at some point in their lives.
60%.
Yeah,
That's huge.
it is.
We're not talking about a minor inconvenience for a small group. This is something that a majority of people on the spectrum might have to deal with.
Absolutely. And it's not always just about those two main factors we discussed either.
Right.
There can be other contributing issues as well.
Okay.
Things like past injuries to the jaw,
Right.
genetics,
Yeah.
even just the general stress and anxiety that many autistic people experience.
Yeah.
It's complex.
This is a lot to take in. So before we move on to the hopefully more uplifting part of this deep dive,
Right.
where we talk about solutions,
Yeah.
is there anything else people should be aware of in terms of recognizing the problem?
This deep dive isn't just about teeth and jaws.
Okay.
It's a reminder that autistic people may experience the world differently.
Right.
And that can manifest in ways we don't always expect. So
Yeah.
being attuned to those differences and those potential struggles is so important.
Absolutely. So on that note, let's talk about what can be done
Okay.
if someone recognizes these symptoms in themselves or a loved one.
Yeah.
What are the next steps? What help?
The good news is there are treatment options available.
Okay.
What works best will depend on the individual and the severity of their TMJ.
Sure.
Some common approaches include things like custom-fitted bite guards to help prevent teeth grinding, especially at night.
Oh, yeah, I've heard of those.
Yeah,
They're kind of like a sports mouth guard, right?
exactly.
Okay.
And in some cases, orthodontics might be recommended to address any underlying dental misalignments that could be contributing to the problem.
So we're talking about a combination of protecting the jaw
Right.
and also correcting any structural issues that might be at play.
Precisely. And then there are therapies that focus more on the muscles and the joint itself.
Okay.
Physical therapy can be really effective,
Okay.
teaching people specific exercises and stretches to relieve tension in the jaw.
You mean like physical therapy for your jaw?
Yeah,
That's a thing.
you bet.
Wow.
Just like you'd rehab a sprained ankle, there are specific exercises to strengthen jaw muscles and improve mobility.
Wow. I had no idea. Okay, so that's bite guards, orthodontics, physical therapy. What
Of course, there's pain management.
Right.
Over-the-counter or prescription pain relievers can help manage discomfort, at least in the short term.
Sure.
Some people also find relief from massage therapy specifically focused on the jaw and neck muscles.
Okay.
Even simple things like warm or cold compresses can make a big difference in terms of pain and inflammation.
This is encouraging. I was worried for a minute there that this was going to be one of those, well, it's a thing, but you just have to live with it kind of situations.
Right.
But it sounds like there are concrete steps people can take to address this.
Absolutely. And I think the most important takeaway here is that if you're experiencing persistent jaw pain, clicking, popping, any of those symptoms we talked about, don't just ignore it.
Yeah.
It's not something you have to live with.
Right.
Talk to your doctor, see a dentist or an oral surgeon who specializes in TMJ,
Right.
and figure out what the best course of action is for you.
Knowledge is power.
Right. Absolutely.
The more we understand about these connections between autism and other aspects of health and well-being, the better equipped we are to advocate for ourselves and our loved ones.
If this deep dive sparked your curiosity, remember that sharing this information with others can make a world of difference.
Exactly. This is just the tip of the iceberg when it comes to understanding the complexities of autism. We'll keep diving deep, so stay tuned. This is so true. It's like you're saying, just knowing this connection exists can be life-changing for some people.
Exactly. And think about it. This knowledge empowers us to ask the right questions, you know?
Right.
If someone you know with autism is having trouble with focus or seems irritable, it might be easy to jump to conclusions.
Right.
But what if just maybe it's related to chronic jaw pain they haven't been able to express?
Oh, wow.
Yay.
That's a really powerful way to frame it. It's about looking beyond the surface, considering the whole picture, right?
Absolutely. And this deep dive has only scratched the surface. There's so much more to explore when it comes to the unique ways autism can impact a person's physical experience.
Yeah, it makes you wonder what other connections are out there waiting to be understood.
Exactly. And the more we understand, the better equipped we are to support individuals with autism in living their fullest lives.
Well said.
Yeah.
So to everyone listening, if today's deep dive sparked your curiosity, don't let that feeling fade.
Yeah.
Share this information, keep asking questions, and let's keep learning together.
Knowledge is power, especially when we share it.
Couldn't agree more. And on that note, we'll wrap up this deep dive. Until next time, keep exploring, keep learning, and keep diving deep into the fascinating world around us.